Interstitial lung disease happens in the interstitium of the lungs, which is just the connective and supportive tissue of the organ, meaning not within the airways. So unlike asthma or COPD, it's not the actual lung tubes or airways themselves, but rather the tissue underlying that. In dermatomyositis, what we are concerned about is a fibrotic process of the lungs. This is a type of scarring that occurs, and it can occur in about 20 to 30% of patients with dermatomyositis. And sometimes it happens in a subacute to chronic fashion, meaning that due to prolonged or chronic disease course of dermatomyositis, a patient may develop mild or even subclinical interstitial lung disease. Of particular concern is something called rapidly progressive interstitial lung disease. This is rare, and it most commonly happens in the setting of MDA5 associated dermatomyositis. MDA5 is a specific autoantibody that we look for specifically in order to assess for any risk of underlying lung disease. Even if you get a diagnosis of MDA5 positive antibody dermatomyositis, this does not mean you will get interstitial lung disease. In fact, you can have MDA5 positive dermatomyositis and even get a subacute to chronic interstitial lung disease, meaning one that happens over more of a delayed time. What we are vigilant for as physicians is looking for the small amount of patients who develop an MDA5 positive dermatomyositis and who also develop a rapidly progressive interstitial lung disease. This must be treated quickly to avoid progression. Symptoms that a patient might have that could indicate interstitial lung disease are a dry cough, shortness of breath, even just feeling weak and fatigued with mild exertion. I've had patients who said it was hard to get across the parking lot, for example. Some of the patients with more rapidly progressive interstitial lung disease, they might not receive that diagnosis at first because they've yet to be diagnosed with dermatomyositis in some cases. Those patients that I've seen tend to present to urgent cares and emergency departments with infections of the lung and with certain findings of the lungs like pneumothorax, which is a collapsed lining of the lung. At the time, this might be attributed to some other cause, but it is really due to the undiagnosed dermatomyositis.